Welcome back to the show. All right, so do you have a family doctor? Because if you do, consider yourself one of the lucky ones. As part of our Care in Canada series, today we are diving into the issues plaguing this country's primary care system.
And here to walk us through the state of the family physician shortage and how we might fix it is Dr. Kiran, a family physician and researcher at St. Michael's Hospital and the University of Toronto. Nice to see you again, Dr. Kiran.
Thanks for having me. So let's dive in because it's nearly impossible to get a family doctor in this country, but you say this isn't a numbers issue. So what is the problem?
Okay, so it's a bit of both. There is a numbers issue in the sense that, a federal report actually came out about a few months ago, and it said that there are about 23,000 family doctors short in this country.
Wow.
So that's a big number. But at the same time, we can't just train our way out of the problem because we know more and more family doctors people being trained as family doctors are choosing to work in different areas. And then even those who are family doctors, it's taking longer per patient because patients have more things going on and there's more system to navigate. And doctors nowadays don't want to work the same hours that, people did 30 years ago. And that's something that's true, across professional groups.
Okay, so you're saying that people are getting trained up as family doctors, but then they're going into other practices. So where are they going?
Yeah, great question. So we did a study on this, and we looked at about 30 years of data, and we saw more and more people are choosing something called focused practice. So this is like a focused area like anesthesia or palliative care, addiction medicine, but actually more and more of them are choosing to work in a hospital setting. So by far the biggest focused practice areas are emergency medicine, which is actually, pretty common over the last 30 years. Lots of family doctors do emergency medicine, but the growing area is hospital-based medicine. So looking after sick patients in hospital who, before you got admitted for a surgery, the surgeon would take care of you. Now it would be a surgeon and a family doctor maybe. And people are choosing that, family doctors are choosing that because their relative pay and the working conditions are often much more attractive in a hospital. It means, you don't have to run your own business. You've got a team with you. You can take time off when you need to, and you don't have to worry about your patients. So
that's really
interesting.
A big one. It's huge. So what I'm hearing is that Canada actually really needs to make family medicine more attractive to physicians. So are we seeing any efforts? And if so, what are they?
I think governments are starting to get it, and we see some really good progress happening across the country. So we've had new deals struck between governments and family doctors now in British Columbia, Manitoba, Nova Scotia, more recently in Ontario, where family doctors are getting a relative pay increase. So family medicine is paying closer to what other specialties are being paid. Crucially, the payment actually recognizes all the work we do behind the scenes, administrative work, paperwork, to try and support patients navigating the system. And then the other thing we're seeing is governments investing in team-based care because they know that we don't have enough family doctors to go around, so we need to extend family doctors. So here in Ontario, in February, the government announced $1.8 billion for teams with the goal, hopefully, of having every person have a family doctor by 2029.
Okay.
Okay, that sounds good. All right, so Dr. Kiran, I want to start this next question with a photo. It's actually a picture that you took of an emergency waiting room in the Netherlands. And as we can all see, do we have that picture up yet? Oh, there we go. As we can all see, it's completely empty. I have never seen that before. This feels like a fantasy in this country. So you say this all comes down to their primary care system. So explain that to us.
Yeah, so I took this photo on a Monday evening at 9:30 p.m. So you can imagine what that would be like in an emergency department here in Canada. And yeah, it's because their primary care system works. So 99% of people in the Netherlands have a family doctor. And it's not just that they have a family doctor, but they can go get in to see their family doctor in a timely way. They've set up their system like that. And so the doctors have structured their clinic so that you can get access through a phone with somebody in the clinic when you need to right away.
24/7?
Doctors exactly are actually contractually obligated to be responsible for patients 24/7 if they're their GP. And they do that actually partly through banding together to have after-hour centers that look after the whole region. So as a patient, you have one number to call for the whole region. You call that number and the doctor, we'll talk about doctor's assistants, but they actually are the ones that are answering the phone call, and then the doctors, are looking after everybody in
So
that
it's not that
region.
one doctor is on call 24 hours. Is it that there's a team? Which we're
Yeah,
gonna
so
get into.
dozens of doctors are working together in one regional center, covering hundreds of thousands of people.
Yeah, and I'm going to quickly put this in there because we did a podcast together. And so if you actually need emergency, it's only for the cases when you actually need it.
Yeah, so family doctors are actually the first point of contact for everything. And so if you need to go to the emerge, you still have to call your family doctor unless it's a life-threatening issue. So everybody goes to the family doctor or these after-hours care centers, and then if they need to, they'll go to the emerge.
Okay, that's why it's empty.
Yeah, that's why it's empty.
Okay.
Yeah.
You said practice assistants. This is the secret sauce.
That's
Who are they?
right.
What do they do?
Yes, they're kind of a cross between a receptionist and a nurse, and they've been trained specifically for primary care. So they know the triage algorithm. So if somebody calls in with a cough, a fever, a sprained wrist, they know kind of how acute the issue is. They know whether it needs to be can be resolved on the phone, or actually whether they need to be seen today, if it can be seen in a week. And they actually, in the Netherlands, they also have a lot of home visiting. So they also know, okay, actually this is someone where the doctor needs to go to their home to actually assess them. So they're really the right hand of the doctors in the Netherlands.
Wow.
Incredible. So in 2022, you launched a nationwide survey to determine what Canadians really wanted from our primary care system. And this year, the government, Ontario government, introduced a Primary Care Act based on your findings. So this is incredible for you. But why is this also great and good news for our country as a whole?
It's amazing news for the country. I mean, Ontario is leading the way here. Back in 2022, we started this process, Our Care. We heard from thousands of people across the country about what mattered to them when it came to primary care. Things like everybody having a family doctor, timely and ongoing care, looking after the whole person, making sure you have access to your medical records, making sure there's no racism or discrimination and that there's transparency. So these elements that people said they wanted, these are now into a law that the government has passed, actually saying primary care is the foundation of the system. Here are 6 objectives that system has to keep. And I don't think this is just words on a paper. I really think the government is committed to making this happen and reporting transparently on it. And I think Ontario's leading the way, and I'm hopeful other provinces are going to follow suit.
Yeah, we can only hope. All right. So we know what's going wrong in the system, but we don't often talk about what's going right when it comes to primary care. And I know you discuss this on your podcast, Primary Focus, and you explore what's going right. So what is working well with our system?
You know, I've been really buoyed hearing about all of the wonderful work that people have been doing across the country when I was traveling to meet people. And, I wanted to share those stories with people. And so some of the things we do on our podcast is we take people sort of behind the scenes in a clinic in Renfrew County in Ontario, a small rural area where lots of people don't have a family doctor, but they're using virtual care in an innovative way to try and get care to more people. For example, doctors may be working in Toronto and working with a paramedic there so that they have a bit of both things, trying to make it work. We've got researchers in Quebec providing timely care and doing this in dozens of clinics at one time. So how can we use teams to provide timely care? A place in Calgary, actually, where they're doing team-based care really to the max, so a doctor can see lots more patients than they would otherwise. And then one in Vancouver that comes to mind where, they're using something called cross-cultural health brokers to really serve newcomer populations in a way that's culturally safe and also provides care in the language that the newcomers speak.
Love that.
Wow.
That's great.
Dr. Kiran, thank you for all the work that you do and for joining us today. Thank you. Thank you.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.